my name is Dr. Clifton Otto. I'm a medical doctor licensed to practice medicine in the state of Hawaii. I'm also what you would call a cannabinoid medicine specialist. I specialize in the practice of cannabinoid medicine. It's a developing medical specialty. I've been certified by the American Board of Cannabinoid Medicine to practice cannabinoid medicine. I think there are only 3 of us in the state right now who've gone through that certification process. Prior to doing this, I was an ophthalmologist, actually a retina specialist, traveling to the outer islands to treat patients with macular degeneration and diabetic retinopathy, and transitioned over to doing this full-time during the pandemic. So that's where I'm coming at to this issue. I also have a science background in chemical synthesis at the University of Hawaii and Wyeth Arist Pharmaceuticals in New York. So I have a little bit of technical knowledge from that aspect as well. Well, so some people would say it's not that difficult to transition because the first medical condition that was recognized by the federal cannabis program, the IND program, was for glaucoma. And THC has been shown to reduce intraocular pressure. And so there is a medical indication for using cannabis for treating glaucoma that certainly needs more research. But so that there is that connection. But also there was a personal connection with a family friend who had intestinal cancer and had to go through extensive chemotherapy before and after surgery and extensive surgery. And so that gave me firsthand experience or exposure to the medical use of cannabis. And I was really impressed with the improvement that this friend was able to experience. And so that kind of stimulated my interest in the subject. I started looking at some of the clinical research that was done, a lot of it back in the 70s. And then also started looking at our own Medical Use of Cannabis Act and realizing that there were a lot of inconsistencies, a lot of gray areas, and a lot of problems that were impacting our medical cannabis patients. So I've kind of become a bit of an advocate, just a solo doctor trying to do what I can to protect our patients and make sure that they are able to use cannabis safely and effectively under state law. But I think that, and yes, this is an issue that has been affecting patients for decades because of the federal situation with cannabis and because of the very unique geographic characteristics of Hawaii, because of the location of the different islands. It raises very interesting and complex issues related to interstate commerce. So it looks like what are called the jurisdictional limits of the state only extend out from about 12 miles from the outer boundary of each island. So if you draw the circles, you'll see that some of the islands, namely Oahu, Molokai, Lanai, and Maui, are connected, whereas Kauai and the Big Island are outliers. So this raises issues about whether it's legal for patients to travel to those islands with their cannabis. And I think you've probably seen that 2019 broadcast by Hawaii News Now that discussed a bill that was introduced and actually vetoed by the governor at the time for various concerns that I think could have been addressed if we had a chance to do that. But this was initiated because of a patient of mine, a cancer patient, and this is all public knowledge. She volunteered all of this in the interview at the time, who was trying to travel from Oahu to the Big Island with her, her children, her infants in tow, had very small amount of dried cannabis flower in her carry-on, was stopped by TSA, TSA does have the ability to detect flower material in carry-on items. They do have a radiologic protocol for detecting this item. And so they picked that up, pulled her aside, was given a bit of a rough time. But as you probably know, TSA is not responsible for drugs. They're responsible for weapons and firearms, things that would endanger the safety of the pilot, passengers, and crew members. And so the standard policy is to refer those customers, those patients who are found to have cannabis, to local law enforcement. So every airport in Hawaii has a local law enforcement unit attached to it. In terms of Honolulu International Airport, it is the Sheriff's Division. So she was then interviewed by the Sheriff's Division and basically given several choices. Either she could have gone back to her car and left that material in her car. She could have had a patient friend come and pick up that material. She could have just gone home and given up on her flight altogether, or she could have surrendered the material. The fifth option was if she decided to hold on to the material and board the plane, she was informed that she would be arrested upon arrival in the Big Island. So I think she did the reasonable thing and surrendered her material, but that put her in a position where she was without her cannabis medicine on the Big Island, suffering from very painful chemotherapy-induced peripheral neuropathy. And even though, as I'm sure you may have found, there are dispensaries on the other islands, patients go to extensive lengths to find a particular product that works well for them. And the reason for this is that cannabis seems to be more individually specific than any other substance that I've seen clinically. And every patient seems to respond a little differently. That's why it's so dangerous to be getting medical advice from bud tenders at dispensaries. So this patient suffered for days and was not able to gain access to material that actually worked for her. And so that kind of brought this issue to the forefront and stimulated this bill, which, as you saw, was vetoed. So we're still dealing with this issue, and we really haven't made any progress. And I can talk a little bit more about that if you'd like, and some of the things that are obstructing the state's ability to make progress on this issue.
What are some of those obstructions?
Well, so I'm just going to go back and refer to some of these emails that I sent to you. So I think one of the main obstructions is a political will within the state administration to address this issue. As I mentioned, it is complex. It involves interacting with state regulation, federal regulation and federal laws. And there's a general attitude that we can't do anything about this issue until the federal government acts. And I think that's a misconception and something that our legislature addressed in 2021 when it adopted a resolution unanimously in both chambers. It's called HCR 132, currently sitting with the Department of Health, that asks the Department of Health and the state administration to do something about this problem, this situation with cannabis due to the federal scheduling of cannabis. And it lays out a very simple process for getting a federal exemption that we really haven't gotten much discussion on. And so that's something that I think is still on the table, but something that really needs to be addressed with the push for recreational legalization right now. So, but that's kind of a separate issue. But anyway, first it's the political will. And then I think the next issue is what is currently existing in statute. So if you look at HRS 329 122, which is a section of our Medical Use of Cannabis Act, it talks about transportation, and there is specific allowances for transport of samples by dispensaries between islands, because everything has to be tested before it can be sold. We currently only have one cannabis lab, certified cannabis lab in the entire state, located primarily on Oahu. So dispensaries must get their samples over to Oahu so they can be tested, so they can sell their products. And there's also recently been added a provision where dispensaries can transport products to other islands between each other. But there's also description of inter-island transport as it applies to patients. And the statute specifically says that this inter-island transportation by any means or for any purpose between a qualifying patient, primary caregiver, qualifying out-of-state patient, or a caregiver of a qualifying out-of-state patient. So this word between is key, because what about patients just transporting for their own personal use? That does not seem to be specifically addressed. And yet, if you're caught at the airport trying to transport a cannabis product, you will be given these options. So, and I'm not trying to encourage patients to travel to other islands with their cannabis products. I specifically advise my patients not to do so because of the current confusion and the current attitude of not allowing patients to fly. So I don't think it's safe. So even though I wish that patients could have access and be able to carry the medicine that they've found to be effective for them, I think it just adds too much additional risk. So so then the other impediment is this concept called concurrent jurisdiction. And basically that means that we can have state law enforcement agencies that work in coordination with federal law enforcement agencies for a common purpose. So it is possible for state law enforcement at our airports to also be enforcing federal law. And I think you've seen the protocol from the Sheriff's Department at the Oakland International Airport. I think that was adopted back in 2007. So a lot of other states at their airports recognize that their job is to enforce state law, not federal law. And so they will allow customers who are abiding by state law to board planes with their cannabis. It's kind of like firearms. You're responsible. The customer is responsible for making sure that you are complying with the state law where you land. However, here in Hawaii, because of this very close connection between state and federal law enforcement and narcotics enforcement agents, our state law enforcement agents at the airport can enforce federal law. And so I think that's part of what we're seeing. And this is an environment that is very unique to Hawaii, I think, because of our history of how we treated a sovereign nation in the past. And the other blockade is the prohibition of pilots from transporting cannabis aboard aircraft. This would put their pilot license at risk. There's very clear policy from the FAA on this. And so in some states where this issue has come up, where the state might have some outlying islands like Massachusetts or Alaska, the kind of unwritten policy is if you're going to transport cannabis aboard an aircraft, just make sure the pilot doesn't know. Somehow that's going to make everything okay. And I think that kind of attitude of trying to stay below the radar is what is encouraging a lot of criminal activity in this industry right now. But there's also a federal exemption, 14 CFR 91.19, which specifically exempts the carriage of cannabis aboard aircraft if it's authorized under state law or by a state agency. So it seems like there's a pathway for us to figure out how patients can transport cannabis uh, between islands within the jurisdictional limits of the state. And I think that would also include making sure that patients are not being subjected to federal Schedule 1. And as I mentioned, there is a way to do that as well. And we even have a precedent for that because members of the Native American Church are able to enjoy what they call legal safe harbor from the criminal penalties associated with federal Schedule 1 because there is a federal exemption on the books. It's been on the books since the beginning of the Federal Controlled Substances Act that specifically exempts members of the Native American Church from federal Schedule 1 for ceremonial purposes. And it also sets up a pathway for distributors of peyote to supply members of the Native American Church. And these distributors are registered with the DEA and regulated by the DEA, and it's all legal at the federal level. So there is a lot that could be done to move this issue forward. But again, that kind of brings us back to the issue of political will and the willingness to address this issue head on. Well, so I would say, yes, it's a human rights issue. It's a constitutional issue because states have retained the authority to decide how cannabis is regulated within the state. The state exercised that authority in 2000 and created a state medical cannabis program, but it never went back to the federal government to try and work out a solution. How do we have, how do we support the rights of patients to decide how they want their bodies to be treated, while not subjecting them to the discrimination that comes along with having to violate federal law? I don't know of any other program that requires patients to violate federal law in order to participate in the program. Of course, the state is not requiring patients to violate federal law. The state will tell you that they are not violating federal law at all because they are not supplying cannabis to patients, and it is up to the patient and the dispensary whether they want to participate. But in order to participate, you have to violate federal law, which exposes patients and dispensaries to significant risk and discrimination. So there are many things that our patients are suffering from. So you mentioned firearms. You cannot get a firearms permit approved if you admit to being a medical cannabis patient under state law, or if they discover that your name is on the medical cannabis registry database. And that's a serious issue for our veterans and for those on the outer islands who may hunt for part of their livelihood, or those who have legitimate concerns about home safety and security. And in addition, you cannot get federally subsidized housing if you admit to being a medical cannabis patient. So we have patients that are hiding their cannabis use, again, which is encouraging dishonest behavior. You have a lot of patients who are experiencing problems with employment, either because they can't pass a pre-employment drug test or because they work for an employer that has a zero drug test policy. They get caught on a random and all of a sudden they're being disciplined or just flat out losing their job. So, and in addition to this interstate transportation issue that you raised. So these are issues that are not very well known because when this occurs to patients, they're basically on their own. There's no help from the state. And a lot of times they are afraid to raise these issues because they don't want to be targeted. And they already feel like they are at a disadvantage because, as I mentioned, they have to violate federal law. So they already feel, in some regards, like they're criminals. And that's a very compromising position to put a patient in who is already experiencing many difficulties because of their chronic debilitating illness. And then there's this kind of secondary injury that's occurring because our dispensaries, being that they are considered continuing criminal enterprises by the IRS, are not allowed to deduct their regular standard business expenses from their federal tax returns. So they're paying about a 70% tax burden on all of their revenue. They also cannot use regular banking services. And so this adds costs to the dispensary products that is passed on to patients. And patients, as a result, are not able to afford a lot of the top shelf products that they may need to treat their particular condition. And then they're turning to other sources, which puts them at risk for dealing with the illicit market and the dangers inherent in that. So it's hitting patients at many different levels. And that's part of the reason why I'm trying to speak up about this, because this needs to change, especially if we're going to move forward with adult use. Yes, it's interesting how this is all playing out at the regulatory level, the economic level. There are so many forces that are pressuring Hawaii right now. We have the mainland cannabis industry that is putting a lot of pressure on the state. Probably the Democrat Party as well, kind of saying, well, what's wrong with you guys? Why are you taking so long? But we have to realize that Hawaii is incredibly unique. We are unlike any other state for so many reasons. And so we're not going to get past this until we accept that and figure out a solution. We can't keep just burying our head in the sand and hoping that somehow things will get worked out at the federal level and using activities in other states to kind of justify moving ahead. So I agree, this is a human rights issue, and that's why the state moved forward with this in 2000. I think it might more appropriately be called a compassionate use program. That was the name of California's bill when they first passed this in 1996. And this is really, it's not really medical sense in the strict sense of the word, because this is not a pharmaceutical product. This is not FDA approved. We're basically saying patients are suffering. We need to help them, and they have the right to decide what happens to their bodies. So, but with that also comes, I think, a moral and constitutional obligation to do something about it, to solve it, to work with the federal government to figure out how to stop this. And I think there's an attitude that I've heard from many different groups that there's this fear that if we try and work this out with the federal government, it's somehow going to bring bad attention towards our program, that the federal government is all of a sudden going to try and shut down our program because we're trying to offer a solution that maybe they actually have been looking for. Maybe they're waiting for a state to figure this out, because it's not up to them to fix this. It's up to the states, because they created this problem in the first place. So that moral and constitutional obligation, I think, needs to be recognized and brought to the public discussion and addressed at the state level. But again, we're back to the political will of our current administration.